Welcome to the Mind Body Couple podcast.
I'm Tanner Murtagh.
And I'm Ann Hampson.
This podcast is dedicated to helping you unlearn chronic pain and symptoms.
If you need support with your healing, you can book in for a consultation with one of our therapists at Pain Psychotherapy.ca.
Or purchase our online course at embodycommunity.com to access in-depth education, somatic practices, recovery tools, and an interactive community focused on healing. Links in the description of each episode. Hi, everyone.
Hi, everybody.
Welcome to our Halloween episode.
That's it. I guess it is our Halloween episode. Halloween is soon. It's approaching.
It's approaching.
Yeah.
As you all probably know, we have young kids.
And so we love and hate Halloween at the same time.
Yeah, it's fun.
It's fun. It's just stressful.
I think I've
a lot to do.
Yeah. I've watched the movie Hocus Pocus and Hocus Pocus 2.
Which is not as good.
Yeah, it's not as good.
No.
It was all right. I'm glad they did a second one.
Mm-hmm.
I've watched those movies like 20 times at this point in October.
Yeah, that happens leading up to every kind of like event or holiday, this intense, repetitive movie watching. I'm sure some of you might relate to this.
It's adorable, though, because our 4-year-old daughter's like, Which show? Like she wants to
Oh.
She struggles to say Hocus Pocus. You know?
Yeah.
It's a hard word to say.
It is.
I practiced a few times before we came on.
Good.
There you go.
Good job, Tanner.
I know.
Wow.
So we have a spooky sale.
Yes. In in light of the fact that it is Halloween coming, it is a spooky sale.
Spooky.
Spooky.
Spooky sale. And this is for our course, The Somatic Safety Method.
Yeah.
It's going to be 25% off from October 29th, beginning first thing October 29th,
Mm-hmm.
right until end of day November 2nd.
Yeah, totally.
Don't be afraid. We can heal together.
Yes. Yes, I like that.
Now, our topic today, we're going to dive right into this. How to stop the spooky beast of pain and symptoms.
Yes.
Now, spooky, we're using this for Halloween, but we also want to be clear here. We know pain and symptoms can be way more than spooky for people. So
thanks for clarifying.
I just,
this, Tanner.
I didn't want to feel like we're invalidating people by saying spooky.
I know.
It was a Halloween pun. That's what
we all know this, Tanner.
I
feel like you don't need to go into this.
I'm a therapist.
Wow.
I'm a therapist. I'm worried about people's feelings, Anne.
Yeah.
This is an important part of being a therapist.
It's funny, you guys listening, because this is me and Tanner's dynamic. Not that I don't worry about people. I totally do. But Tanner, I have to, tell Tanner, it's okay.
You're gonna rein me in
You're
a
okay,
bit.
Tanner.
Yeah.
I have to rein him in a bit.
Yeah. It's the people pleaser in me. It comes alive a little bit sometimes.
Yes. Yes.
So remember, pain and physical symptoms occur because our brain believes you're not safe. The brain creates these symptoms when it is misreading safe signals from the body. It's afraid of what you're doing, of what you're being exposed to, and because you're feeling overall dysregulated.
Yes.
Essentially, it's feeling spooked.
Right.
And there can be, of course, past things from far in our past that cause this kind of prolonged dysregulation.
Mm-hmm.
But that's what we're going to talk about today. And when we talk about nervous system survival responses, and we're going to explain them, so don't worry, people. But fight, flight, fawn.
Fawn is a new one. If anyone's like, what did I just hear there?
We're throwing fawn in. And freeze or shutdown.
Mm-hmm.
And we often have these responses to our actual symptoms. And this actually feeds the beast.
Mm-hmm.
It feeds the beast of chronic pain and symptoms. And it's a very kind of Halloween episode because we want to talk about these responses that we have to our symptoms that spook us more and that perpetuate them forward.
Yeah. Well, and then that's a really good point. And it's important to keep talking about it and keep reflecting on this idea that this kind of dysregulation or fear around the symptoms, and then there's fear piled on to fear, that keep it going. And it's important to really take a look at that.
Yeah. Now, the good news is we can shift to safety in our response. We can take away the energy that feeds pain or physical symptoms.
Yes.
And we can starve it of its life force. And it's also very Halloween-y what we're doing here, you know? And
Good.
just
Good.
really hammering home that
I think everybody's really impressed that you keep bringing in this Halloween theme now.
I'm getting after it, you know? And if you've been learning about mind-body approach, maybe listen to our podcast, you've probably heard of the pain-fear cycle.
Yes.
This comes from Alan Gordon, the creator of Pain Reprocessing Therapy. Now, at our clinic, we talk about it with a bit of a different terminology, but we want to give credit to Alan Gordon.
Yeah.
We discuss it as the sensitization cycle because we include the nervous system states in it. And we understand this because it's more than just fear. It can be fear in different forms, and it's this nervous system dysregulation that keeps things going.
Yes.
And this cycle can go on and on and on. I've seen people caught in this cycle for decades.
Right.
For myself, this was definitely driving my symptoms by the end of it. Essentially, you understand you have pain or physical symptoms. And then in response to pain or physical symptoms, you're human. So you respond with fight, flight, freeze, shutdown energy. And that actually causes your brain and nervous system to feel even more in danger, more dysregulated, and it produces more pain and symptoms.
Yes.
And the cycle just goes on and on.
Yes.
And, we typically respond by going into these defense states to pain or symptoms. Like, this is a normal human response when we feel something unpleasant.
Right. And so it's important, if you recognize that you're in this or you've been in this, that it makes sense why you're in this. And we need to learn to have compassion towards ourselves and not beat ourselves up or punish ourselves for this.
Yes, we don't want people judging themselves for going into these defense states because this is normal.
Yes.
And, I want to break down kind of these 4 defense states, survival responses we're talking about. We talk about fight.
Yes.
Some people respond this way. I did at first to my physical pain for sure. This can look like frustration, anger, trying to push through it, like pushing yourself to do more even though you're in pain, and trying to fix it. For some people, they have this flight energy. I've been known for that. That's definitely a place I can go pretty easily. And we can respond with fear, fixation, anxiety, seeking excessive treatments to get done. We also include Fawn because this can be a response that we see with the people we work with. So instead, imagine if you're having pain or physical symptoms, instead of caring for ourselves or our needs while we're in pain, we respond in this dysregulated way by trying to get approval from others or appeasing others.
Okay.
I see this often with people where this is the behaviors that they typically engage in when they get dysregulated.
Do you have an example maybe of how that might look?
Yeah, so this could look, there's a lot of different ways it could look. But especially with the fawn response, I've seen people where they have a pain flare. And, when we have a pain flare, some strategic avoidance, caring for yourself, giving messages of safety is vital. But instead of that response, they get so dysregulated by the pain flare that now they're still kind of pushing through, taking care of their family, going to work, appeasing their boss. Like, they almost respond when they get dysregulated by engaging in this kind of fawn behavior, essentially.
Okay, so not caring for themselves.
Exactly.
Or kind of listening to the pain a little bit, just pushing on.
Exactly. They don't put their needs first, and they still engage in kind of this fawn response to things.
Something I think can be confusing about that is that if we don't want to react to the pain, we don't right? There can be this element of like, I'm going to move forward,
Mhm.
but we need to kind of take care of ourselves. So is it a balancing game?
It's a
Or
balancing
because I think
act.
some people might
Yeah.
hear that and be like, well, I shouldn't give the pain power and I should still live my life.
Yeah, and I think to some degree that's okay. There's a difference between living life, leaning into positive experiences, expanding your life in a meaningful way, and having a fawn response where you're now just appeasing everyone around you, you're seeking approval. You're essentially you get what I mean? Like
Yeah.
there's a very different motive behind these
Okay.
behaviors.
Well, and that's something to think about then. If you are listening and you relate to this, of like, okay, what is behind it? Because I think
Mhm.
that can get a bit confusing sometimes.
Yeah. Because even with exposure work, when you're expanding your world, I want
Mhm.
people to do it from a place of love.
Mhm.
A love, care, support for themselves. They're pushing themselves a little bit into discomfort, but it's
Yes.
from this place of love.
Mm.
When we're engaging in things like perfectionism, people pleasing, appeasing, that's coming from a place of fear.
And that's important to know, like if we're exposing or pushing through, what if that's underneath it?
Yeah.
Yeah.
Now, this last defense response is the freeze and or shutdown.
Yes.
And this can look like despair, immobilization, shutdown, hopeless, helpless, numbing, kind of avoiding behaviors taking place. And see, what most people do when they have pain or symptoms is try to fix it, avoid it, or to change the pain or symptoms. That's what we're doing. And, when we get physically injured, that's what people typically do. They ice it, they rest it. But it doesn't work typically with symptoms that are neuroplastic. It
Right.
just keeps you in that sensitization cycle. And so instead, we need to use brain retraining practices to change the nervous system responses, emotions, and our thinking about our symptoms. So we don't need to change the pain or physical symptoms. We need to change the response that's taking place.
Yes.
And today, in this episode, so this episode is not 3 hours long, we're going to focus more on the cognitive changes.
Mm-hmm.
Now, I want to be clear, this is just one area because working with the nervous system somatically, I think, is very essential. We do this with clients and in our course, working with emotions, starting to increase behaviors and reduce avoidance. All of that's key to break the sensitization cycle. But we can actually start to change our thinking to develop safer responses that can support us in eliminating neuroplastic pain or symptoms.
Yes.
And so one of the big things that we're focused on right from day one when we're meeting with someone is creating new beliefs about your body, pain, or symptoms.
Yes. And this is vital. And so, because I've seen people sometimes struggle with the belief around it, and that's always impacted their recovery. And so, this is a piece really to pay attention to of like, can I change my beliefs? Can I really learn and educate around neuroplastic pain and symptoms and understand this in terms of my own story?
Yeah. And that's why we made this podcast, because we want people to educate themselves about neuroplastic pain and symptoms. The education is key.
Yes.
Right back to Dr. Sarno, that's what he talked about. Like, education is key because people need to understand my body's not physically damaged.
Yes.
My body's not hurt in some way. I'm actually okay.
Well, and if we understand that, that is like the jumping off point to then start shifting those beliefs.
Mm-hmm. And understanding the neuroscience, right?
Yeah.
It shows us that, through sensitization, it can generate a lot of different pain and physical symptoms in the absence of damage or disease in the body. And so coming to understand your symptoms are neuroplastic, your body's not perfectly damaged is essential. We really want to foster that belief that healing our chronic pain and symptoms is possible. This is the other thing that we want to foster, is that it's not just that your symptoms are neuroplastic, but that healing is possible.
Yes. And that can be hard. That can be hard at the beginning of the journey. It can be hard in the middle of the journey. And so we understand that. The more usually I see people dive into understanding this and education around this, it's a bit easier to start to believe that they can get better.
Yeah. And we often go off the criteria for neuroplastic pain and symptoms from pain reprocessing therapy. We covered this our second episode. So if you're like, what, there's criteria for neuroplastic symptoms, go back to episode 2. It's all outlined there.
Yeah.
And that's really helpful because we need to help the logical parts of our brain understand, hey, we're actually okay.
Yes.
Now, the next thing is developing cognitive safety messages. This is another big part of pain reprocessing therapy. Fearful, frustrated, despairing thoughts about our pain or symptoms can actually worsen the sensations over time.
I think you should really say that again and really let that sink in for people because it's really important, I think, to understand that.
Yeah, because people don't think to change this right away. But fearful, frustrated, despairing thoughts about your pain or symptoms can actually worsen the sensations over time.
I've talked with people that have tried to step outside and be curious of how often they're having these type of thoughts about their pain or symptoms. Yeah. And they realize it's going on constantly all day long.
There can be this obsessive preoccupation. And that's the thing is at first, I think people were very conscious of it when they start to do it. But over months or years, it just becomes what people do.
Yes, it becomes very automatic. Yeah. Same with scanning the body, looking for danger. It's automatic as well.
This relates back to our brain retraining episode we did. I think it was 5 or 6 episodes ago.
Yeah.
Don't LCTT. Instead, shift. It's such an awful name.
You have to explain what that means right now.
It means don't look, check, think, or talk. Instead, shift. And we're shifting to safety. We're not going to outline it all here. But that's essentially what we're doing. We're moving people away from the thinking because when I was in widespread pain, you know this. You probably have not great memories of myself at this time. I was so obsessed. I was thinking about it 80 or 90% of my day.
I remember, and I remember how much that consumed you, Tanner, and how overwhelming that was, and then how hard it would be even to shift out of that into kind of safer beliefs.
Yeah, and so using brain retraining, we can start to change our thoughts about our symptoms by utilizing these cognitive messages of safety. So we have some examples here that Anne has agreed to read.
Oh my gosh. I would love to read, Tanner, but I just want to mention that you did just throw that on me right now. You're not being very truthful with people.
Just trying to pass the ball to you.
All right. I know I'm okay. My brain is just misinterpreting normal and safe sensations in my body.
It's a good one.
I see how my symptoms are inconsistent, moving around, and triggered by emotions. This shows me it's neuroplastic, and my body is healthy and capable. As I read these, I just want to say, maybe see if you relate to any of them, if any resonate for you, or if any don't. That's okay. We just wanted to throw a couple out there. I don't need to control or change these sensations. There's nothing to fix or figure out. My muscles and tendons are healthy. My nerves and ligaments are perfectly intact. My brain is just sensitized and overprotective. It's physically safe to move this way. And then lastly, I don't need to like the sensations. I just need to remember they're safe.
That was some good reading, Anne.
Yeah, thank you. I'm hoping it was soothing.
You have a soothing sounding voice.
I do.
It's really good.
Actually, I just want to say on our somatic safety course, I do a lot of meditation. So if you like my voice, there's a lot of it on there.
Yeah.
And there's Tanner's, but I think people would prefer my meditations.
You have a soothing voice.
I do.
I like
this was like a snapshot of it. But yeah, why did you want people to hear those safety messages, Tanner?
I think it's figuring out, because these are just examples. And sometimes you can use your neuroplastic symptom evidence to help these land a bit more.
Yeah.
Right? Like for myself, I constantly was telling myself, I know this is triggered by stress. My symptoms move around all over the place. They're very inconsistent. For this reason, I know my symptoms are neuroplastic and my body's physically safe. That's a way you can tie in evidence. But these are just examples. Like, I really suggest people, when you're using cognitive messages of safety, is finding the ones that land to some degree for you. You may not fully believe them, but you don't want to give yourself the ones that you believe the least.
Right. And so in this list, like say you didn't know where to start and you had the list that we just read out, and you're like, okay, I'll take something from there. Take something that you feel is most believable to you. And then in time, it's a bit easier to form your own kind of safety message that works for you.
Yeah. And then you're using these messages of safety consistently when you notice yourself having negative thoughts about your symptoms or your body. And this can help your brain in rewiring.
Mm-hmm.
It's an essential step. And while we're not diving into more the body focus side, and we focus on that a lot, somatic side, I love that side. But the other part of this is also it's important. That's why we talked about fight, flight, fawn, freeze, or shutdown, because we also need nervous system regulation. And so we have lots of podcast episodes on that, lots of YouTube content that people can check out. And there's lots, obviously, in our somatic safety method course, somatic being in the name. And so really to wrap up here, I really want people to remember that when you're feeling yourself in that sensitization cycle, when your pain and symptoms and dysregulation is caught in this spiral, first you want to catch this happening. The quicker, the better.
Yes.
You let this go on all day, it's harder to pull back.
But if that's where you're at, that's not like a horrible place to be either.
No.
So I tell people to reflect on their day and be curious. Have I been in this?
Yeah.
And then apply safety messaging. So that's okay.
Yeah, it happens. It gets away from us sometimes, myself included. And it's just reflecting on how could I be aware of this more quickly next time. Second, give yourself a strong safety message that helps you remember that you're safe. And even though this is difficult, unpleasant, and definitely not preferred, we don't love our sensations, you are fundamentally safe. And then third, move towards a safety signal in your environment. This could be a supportive relationship, using maybe a body-focused practice, breath work, processing of emotions. And every time you shift from dysregulation to safety in the face of pain or symptoms, you're starving the beast of pain and symptoms, of its spooky life force.
Wow. I like how you tied spooky in to the very end.
Yeah.
He's looking very proud of himself right now. He's like, yes.
That wasn't me. That was Alex.
Oh, good job, Alex.
Producer Alex.
Ah.
He's all over the spookiness.
Yes.
And so over time, this can shrink your pain and symptom system back to the size it's meant to be. And we do believe people can do this.
Yeah, totally. And so this Halloween, as we predict for us, it's going to feel a bit stressful. It's going to feel a bit overwhelming. I think we're going to have like kids in tears. What are you going to notice about your nervous system, Tanner?
I already prepped on Halloween. I got like an hour and a half blocked before the kids come home. Where it says in my calendar, relax, do not book anything.
Smart. I like that.
Yeah.
So you're kind of anticipating this might be dysregulating for you. This might be a lot.
Yeah.
And so you're already creating safety before the spookiness begins.
I learned long ago, and I'm still learning, that...
You are learning still, Tanner.
Wow,
Sorry.
It's really... It's like so
It's like
mean.
one of those podcasts. I apologize.
You're just like going me. I swear, me and Anna are in a good place right now.
I need to do this
what I
sometimes.
was, and I am still learning this, but I learned long ago, like, I can't expect my kids to be regulated if I'm dysregulated. Like, the regulation...
It's been a big lesson for you.
It has. The regulation's got to come from me.
Yes. Interesting.
And so
Interesting.
I imagined, as I put this break in my calendar, I imagined my son after he ate like 20 pieces of candy and his sugar crash started to happen.
Oh, yeah.
And I just thought about, like, I got to be really regulated in that moment.
Wow.
There you go.
Well, thank you for that.
I'm on it.
As, the mother in this scenario, I'm glad you're thinking about that.
I'm on it,
Good for you, Tanner.
There you go.
Yeah.
Well,
Okay.
happy Halloween, everyone.
Happy Halloween.
And we'll talk to you next week.
Talk to you next week. Thanks for listening. For more free content, check out the links for our YouTube channel, Instagram, and Facebook accounts in the episode description.
We wish you all healing.